In New York State, the pandemic's epicenter, 422 new deaths were reported today. That is the lowest daily number this month. And the total number of patients in hospitals is down nearly 25% from the peak. Those are positive signs, but CBS's Mola Lenghi reports on what is still continuing to alarm state officials and health experts.
As most New Yorkers keep their social distancing, a slow but steady decline in deaths and hospitalizations is reason for hope. And yet,
number of new people coming into the hospital, number of new infections is slightly down, but that's basically a flat line, and that is troubling.
In New York State, preliminary results from antibody tests found that nearly 14%, or roughly 2.7 million people, showed evidence of past infection. Chief Medical Correspondent John LaPook.
If it turns out that it's higher than we even think, that's good and that's bad. On the one hand, it's bad because that means that a lot of people have been infected and probably spreading it asymptomatically, and that's hard to get your arms around. On the other hand, it's good because if it's asymptomatic and people recover without us knowing it, then no harm, no foul.
Epidemiologist Maciek Boni is working with Rhode Island on their projected hospital requirements. Tonight, he has an urgent warning.
Well, it's important to not get too impatient. We are in an unfortunate situation. It's going to be like this for many months to come. We're at risk of hundreds of thousands of people dying by Christmas, and it's critical that we take this very seriously for the benefit of our parents and our grandparents, who are the ones that are most at risk.
As the risk management debate rages on for when to reopen businesses, a new report finds the coronavirus may be even more contagious than previously thought. Researchers in Italy found evidence the disease could be carried for hundreds of feet by microscopic particles.
Well, as we mentioned, there's been a lot of focus on those antibody tests with some concerns over their accuracy. And the major question, if you have antibodies, to what degree are you protected against reinfection? Those uncertainties are just some of the reasons why healthcare officials and workers at hospitals like this are stressing, despite some improving trends, not to get complacent, Nora.
A good warning, Mola. Thank you.